talk about coronary artery disease or other artery blockages everywhere in the body, angioplasties, stents and bypass surgery. First, let me explain you how normal heart functions. Heart is divided into two parts, left part, right part. Deoxygenated blue blood comes from all over the body to the right atrium and right ventricular, which is low in oxygen. Now it goes to lung, where carbon dioxide is removed from the lung and oxygen is added. Oxygenated pink blood, red blood, it comes in the left side of the heart, and from there it is pumped to all over the body. This oxygenated blood goes to the body and deoxygenated blue blood comes back to heart. This is the normal function of heart. Atherosclerosis is a chronic inflammatory response and plaque formation in the walls of arteries due to accumulation of blood cells, cholesterol, triglyceride, LDL and many other factors influencing this procedure, homocysteine, amino acids and many drugs what you take, they are chemicals. So they influence this mechanism. That's why people, those who keep on taking cholesterol drugs and blood thinners, still they have reblockage. By chemicals including prescription drugs, they are very, very important. It leads to plaque rupture, which leads to thrombosis, embolism and narrowing of arteries. Therefore, a insufficient blood supply to organ it feeds. It may be in the brain, it may be as a erectile dysfunction first, it can be seen. Many people, they come as first problem is erectile dysfunction because the blockage in the penis. The same way, it can block in the brain, it can block other organs, not only in the heart, because everybody is worried about heart, because if heart will stop, person will die. There are 4 chambers in the heart. Blue, less oxygenated blood comes to the heart, and pink, oxygenated blood goes all over the body from the heart. And there is an electric pulse starts on the top of the right side of the heart. First it contracts atrium, both atrium you can see, and then the blood goes to ventricles, big chamber, and from ventricle then electric pulse go to the ventricle, and ventricle pumps blood all over the body and lung. This is the normal function of heart. In heart failure, basically there is a damage in valve or muscle, heart muscles, and because of the damage it is unable to function properly. You can see in the right side there is a black area which because of heart attack the wall is damaged and it can't pump completely. So always there is some retention in the heart. So heart size increases and it doesn't send properly the nutrients and oxygenated blood to the heart. That's why you are unable to walk, you are unable to perform work, and gradually there is a retention of fluid inside the lung and or over your body. That's why particularly in your feet and your face there is a swelling, you will see swelling. If the compensating artery enlargement process is excessive, when the compensation takes place artery, then if it is excessive, then aneurysm result, which can rupture and hemorrhage can take place. This happens all over body, not only in heart. Everybody is worried about only heart. Cardiovascular disease is the end result of the accumulation of atherosclerotic plaques within the walls of the artery that supplies to muscle and of the heart with oxygen and nutrients. Now, the blood carries oxygen to heart, and if it is not enough, then you suffer from chest pain, and if it is more severe, then people they get heart attack. Coronary bypass and angioplasty are the most common unnecessary surgeries in America. Many of the heart surgeries performed each year are unnecessary procedures that could be putting the patient's life at greater risk. Most drug-coated stent used never approved by FDA. A report in New England Journal of Medicine has shown that the majority of drug-coated stents installed in patients by doctors are being used in off-label cases, that is, cases not approved by the Food and Drug Administration. Drug-eluting stents or wire mesh tubes that release a medicine over a period of time that is supposed to decrease risk of arterial plaque buildup
but they cause thrombosis, are only approved by FDA for use in patients who have only one blocked arteries and no accompanying health problems. But it is given for multiple blockages and associated heart problems also people are using for that. The study has also shown that patients who receive drug-eluted stent have a higher risk of developing blood clots or suffering heart attacks. Bypass are the single most commonly performed unnecessary surgery in the country. Most coronary artery bypass surgeries and angioplasties produce no real benefit to the patient, and dangerous side effects like stroke or brain damage may result from the operation. Only two groups have been shown to benefit from bypass surgery. One is those whose arteries are so badly clogged that the heart can no longer beat adequately. And two, those with severe blockage in the main artery of the heart and signs of resulting poor blood flow. These are the two conditions where this should be done. Otherwise, it is unnecessary. It is not needed. You can see here, this is the coronary artery. It is showing, blockage in the coronary artery, which supplies blood to heart. Now, because of plaque formation, you can see here, reduction of blood flow. Blood flow is reduced. You can see here, blood flow is reduced, and that is how reduction of blood flow causes chest pain and other symptoms in the heart, and it can cause heart attack also. Now, they have put a stent. Angioplasty dilates artery by compressing plaque. It never removes plaque, remember this thing. It only compresses the plaque, and then they are putting, you can see here, metal stent supporting expanded wall. Bare metal stent is put in that. It's a mesh. So in the mesh there is a holes. So again it grows, that is what happens. Restenosis with the side effect of the medication, and because this is a foreign mesh inside the blood vessel. So again for some time the flow is better, but again that atherosclerosis, it takes place because they are working on symptoms. They don't work prescription medicine. They don't work on the cause, the root cause of and we work on the root cause supplements. Now again it is narrowing takes place. That's why restenosis takes place. Out of 500,000 cases every year, 30 to 40% people they get reblockage within 6 months, 3 to 6 months of surgery. So they need again and again reblockage. Now second is drug-coated stent. You can see here. This is drug-eluted stent is the second choice, but it reduces plaque formation, but it increases the thrombosis in the blood. Now you can see here, drug-coated stent. Medical system, drug industries, doctor under the guidance of drug companies through TV advertisements of cholesterol lowering drugs are projecting the cholesterol to be the bad thing, and it is a scare, like cholesterol is a monster. They are projecting themselves as a savior from monster cholesterol. If cholesterol is an enemy, then think senior people, our senior people, they ate too much, multiple folds what we are eating. They ate beef, cheese, butter entire their life, and they live longer, 90 and even in 100 years. Forget about them. Even being in US, I eat 3 to 4 meals. My food is always, it is incomplete without ghee, also known as clarified butter. My family drink whole milk, not this 1% or 2% milk. My dinner ends with dessert. With all this, my blood pressure is always below 100 and 68 is the lower. And you can see my fitness, yourself. So the thing is, and people, they go restricted food, restricted diet. They start with, at the age of 30 years, they start with blood pressure and just one cholesterol or diabetes, and then they increase other problems. And the medication increases, and their problem increases. And you will see many people, just recollect what is happening to you. Those who have been taken bypass surgery or stent in their coronary arteries, or they must be taking continuously blood thinners like Plavix and warfarin, cholesterol lowering drugs like Lipitor, Zocor, Cristor, and other blood pressure of the medication or heart medication. But after taking these medication, they lose their erection. According to the Medical Journal of American Academy of Neurology, people who take the commonly used blood thinning drug, warfarin, if the drug makes the blood too thin, it can increase the risk of brain hemorrhage and increase risk of death if they suffer a hemorrhagic stroke. Hearing loss from aspirin, diuretics, antibiotics and chemotherapy. Many drugs, some antibiotics, quinine, chemotherapy drugs, aspirin, blood thinners and diuretic used in heart problems, high blood pressure and arthritis can cause hearing loss. Aspirin can cause ringing in the ear. In a potentially damaging result, a long delayed study showed Merck expensive Vytorin had no benefits on the building of artery plaque. Patients on Vytorin actually had more heart attacks, cardiovascular death in heart procedures. Vytorin is a combo pill of Zetia and Zocor, generates $5 billion in sales annually for Merck. Doctors recommended taking AstraZeneca's Crestor off the market after cases of rhabdomyolysis surfaced, which in turn causes kidney failure in the trial of people taking it. A Cleveland Clinic study published in the New England Journal of Medicine showed that Plavix plus aspirin nearly double the heart disease death rate among patients who had not yet had a heart attack.